Welcome from Caregiver Cloud to this course on oral hygiene. Proper oral hygiene prevents tooth damage, gum and mouth inflammation, and can even prevent a dangerous heart disorder. Caregivers are expected to know how to assist clients with routine oral care. Denture care or general mouth care should be done at least 3 times per day. Clients receiving tube feedings will need more frequent oral care. Since they are not using their mouth to eat, it becomes dry. Their lips and even their gums can swell and crack. Clients who are not alert can receive oral care with special swabs that keep the mouth clean and moist. Oral care is just one more step in a solid knowledge base that is necessary to keep clients as comfortable and healthy as possible. Let's first discuss the basis of oral hygiene. Preventing tooth damage and mouth inflammation by removing food particles and bacteria in the mouth is achieved by oral hygiene. Daily care of the teeth and mouth is important for a healthy life. Oral care, like bathing, toileting, and feeding, is essential to the total care provided to patients who can't care for themselves. Although the oral cavity is generally thought to be the responsibility of the dentist, many patients never see one. To maintain the ability to chew with one's own teeth over as much of one's life as possible, all people must receive proper oral care on a regular basis. Brushing the teeth and tongue are the cornerstones of oral hygiene success. Toothbrushing is the gold standard of oral hygiene and is advised for almost all patients. Proper oral hygiene should be provided each morning as part of the patient's personal care and should be provided after each time that a patient eats. The day should also end with cleansing of the teeth, tongue, and gums, and a patient's denture should be removed if in place. Even with patients who need help, caregivers should encourage as much independence as possible. Patients tend to exhibit less resistance when caregivers encourage them to perform their own oral care. In order to reduce the amount of bacteria left in the mouth when brushing the teeth, a technique should be used that moves particles of food away from the gums. This will reduce the amount of food particles and bacteria that can become lodged around the teeth and gums, leading to dental decay. The tongue is a breeding ground for bacteria and attacks the teeth and gums, and is also a source of foul odors. Tongue cleaning is necessary in addition to brushing for a thorough dislodging of the plaque that is present in the mouth. Toothbrushing and mouthwashes do nothing to remove oral debris on the tongue. They just mask the bad breath. Tongue cleaning is proven to reduce odors and bacteria in the mouth by 75%. The next section pertains to the special considerations needed for unconscious patients. Oral care should be provided to all patients, even if they are unconscious. However, special precautions should be taken for patients who have an altered mental status. It is important to not place liquids or foreign objects in the mouth of an unconscious patient, as they are at a higher risk of aspirating fluids into their lungs. A moist sponge should be used to cleanse the teeth, tongue, and gums to remove bacteria, but do not use excess liquids that will stimulate a gag reflex. Let's review the proper positioning of patients when providing oral care. When providing oral mouth care to a client, they should be in an upright position. Care should be taken with regard to the position of the person receiving oral care to prevent accidental aspiration of foreign bodies into the lungs. Safe positions for a patient receiving care are in a sitting position, lying in bed with the head in an upright position, or lying on their side. Patients who are severely disabled or unconscious often can't protect their own airway and must be placed in a sitting or semi-reclining position to prevent aspiration. The patient should be approached from the front and coached throughout the procedure. If it works best to stand or sit behind the patient, the caregiver should cradle the patient's head with one arm to perform oral care. What should you do if a patient is resistant? When a patient is resistant to you brushing their teeth, you should supervise and encourage daily oral care. A checklist can be used for each patient to assure that toothbrushing is performed on a regular basis. There are measures that can be effective for patients who are mentally impaired or resistant to performing proper oral care. Placing a toothbrush in the dominant hand of the patient and providing nonverbal cues such as pictures and modeling can be an effective strategy for overcoming resistance to toothbrushing. Using a timer and setting it for gradually longer intervals may promote adequate brushing time as well. Now let's go over how to provide oral care to a person who is prone to gagging. When a patient is prone to gagging or choking, you should moisten the toothbrush with minty mouthwash instead of toothpaste. This will allow the bacteria to be removed effectively without the thick paste that may stimulate the gag reflex. A small pea-size amount of fluoride toothpaste is recommended for use in most patients. Toothpaste should not be used in patients who are unconscious or are prone to gagging and choking. Next, there are special considerations for patients who have dentures. Dentures break easily, so they should be properly handled, especially during cleaning. When brushing dentures, use a soft, bristled brush that is designed for use on dentures to avoid damage. Try to clean the dentures with a soft towel underneath or a container filled with water for safety precautions in case you accidentally drop them. Don't use hot water on the dentures because this can cause some deformation in shape or form. Before placing clean dentures back into the mouth of your patient, you should clean the patient's mouth and gums. For the elderly, proper denture care includes the practice of good oral hygiene. Check for gum bleeding, mouth sores, and swollen gums, which usually indicate problems. If your patient has bleeding or swollen gums or mouth sores, you must immediately consult a dentist or doctor for proper medical attention. This concludes the Caregiver Cloud course on oral hygiene. Copyright 2016, all rights reserved, Caregiver Cloud LLC.